There we go. Hello. So today I wanted to talk about the benefits of having a doula at your birth. So welcome back to my channel. Let me get it right. Let me get it right. Welcome back to my channel. If you are new here, my name is Dr. Allison Zebron. I am the birth PT, and I love helping moms prepare for birth holistically and recover from birth as well through education, education and holistic wellness. So today, let's get into it. We're going to be talking about doulas. And as you guys know, I am a doula. I've been a doula for a couple of years now, as well as a pelvic floor physical therapist. So, what is a doula? First of all, what is a doula? A doula is a person who's non medical, they don't do any medical treatment or anything like that. They are for you, they are for the mom who is giving birth and for the mom who has a baby. They are there to support the mom. They have four main roles that they do: emotional, informational support, advocacy, and physical support. And that can look like so many different things depending on what the season you are, what season you are in, and what you've specifically hired your doula for. So a doula helps with information, like I'm helping with the information, like childbirth education, or helping you get the information that you need. So if they're not doing an entire class for you, they can help you find that stuff, making sure that you are informed for your upcoming birth or postpartum season. So information. Next is physical support. So if you have a birth doula, physical support at your birth can look like hands-on to help relieve some pain, some gentle massage, running around getting you ice and water, rubbing your back, helping you into different positions and things like that. Or if it's postpartum, it can look a little bit different with helping out with tasks in your home. Emotional support, so helping you navigate those emotions of pregnancy and postpartum, helping you to relax and helping you be a bit more mindful of how you're managing stress during this season. Also, for advocacy, so speaking up for yourself or helping you find your voice during your birth if something is not going the way you thought it would, or you don't understand something, helping you speak up and to your care provider, and finding your voice um, in those situations. So that's kind of the things that a doula does, or postpartum doula. So today I wanted to talk about some of the benefits. So those are some benefits right there, all of those roles that a doula does. But some more statistics today I wanted to talk about. And today is going to be a quick video. So a doula, and I'm reading these off of the American Pregnancy Association. A doula can help in so many ways. Like, these ways are so beneficial. There, that's some better lighting. These ways are so beneficial. 89%, a doula can help you, and having a doula will help 89% more breastfeeding by 6 weeks. So those who have doulas are breastfeeding 89% more at 6 weeks or by 6 weeks than if you don't have a doula. It was like 49% without a doula. So that's like a postpartum doula. They can help um, encourage you in that way. Having a doula leads to 10% decrease in the use of pain meds. And I can go over pain meds in a whole nother video, but decreasing the use of pain meds, because sometimes all medication has side effects. But if you are looking for a natural birth, they can also help you with that, because 10% decrease with that. 31% reduction in the use of Pitocin and inductions. That's huge. 34% more people had a positive birth outcome. So having a doula can lead to better birth. So 34 reduction in negative outcomes, negative experiences, just by having a doula. Yeah. Having a doula leads to, on average, 41 minutes shorter labor. Having your labor shortened by 41 minutes, or a 25% shorter labor on average, just by having your doula there, someone that you feel like can support you. Having a doula can result in 15% increase in spontaneous vaginal birth. So instead of your labor not starting, or they're going to induce you or lead to a scheduled C-section, having a doula will in 15% more will increase the spontaneous vaginal birth. Having a doula will 38% by having a doula, there's a 38% reduction in low APGAR scores for babies. So that's a whole scoring system that they do when they do their newborn exams, and the lower those scores are, the worse out your baby is. So lowering those, there's a reduction in the low scores for that, so babies do well. Basically, babies are doing well better when they have a doula present. And then 50% reduction in C-section rate. So having a doula leads to 50%, I know it's hot out here, you see me sweating, 50% reduction in C-section rates. That is crazy, because that is one of my main missions in my life, to reduce the C-section rate in this country. So just by having a doula, someone that you trust there, who's skilled in childbirth, and knows what they're doing, support you, and you're comfortable with them, just by having them, there's a 50% reduction in the chance that you will have a C-section. And lastly, 60% reduction in epidurals. So crazy. By having someone there guiding you and reminding you of the birth plan that you wanted, explaining things to you, advocating for you, giving you that physical support information when you're just too tired to, and you're laboring and you're not understanding what's going on, you just focus on your contractions or your expansions. Having somebody there alongside you, continuous labor support, will be a 60% chance in having an epidural, or 50% reduction in C-sections. So just those stats by themselves are just crazy. And that's just by having a doula there. And that's just one thing. All the other things I explained in the beginning, the information support, the advocacy information, and emotional support of having a doula present. So those things are just crucial, and I encourage you all to have a doula if you don't have one already. So I hope this was informational, and I hope this gave you some encouragement. And if you're on the fence about having a doula, this might encourage you to get on it, get that doula. So I hope this was informational and encouraging, and I will see you guys in another video. All right, take care.